Nan Hayworth, and joins us now on the Newsline. Congresswoman, welcome to the program.
I'm very glad to be with you, Roger. Thank you.
Now, I'm sorry if I've missed all that publicity you've been getting, but you're one of those people that I don't think I've heard much from, but I know that you have pretty strong opinions and pretty informed opinions about things like Obamacare and Medicare and all the rest of that, so I'd like to talk to you about it.
Well, I'm delighted to speak with you about it, and I appreciate your giving me the opportunity.
You're in New York, which is not a conservative state. You're in an upstate part of it there in Westchester County and so forth, but really, what do you think is going on with Obamacare among your constituents? And then I want to ask you, in the second part, what would you like to do if you could wave a magic wand here? What would you like to do about it?
Well, it's deeply unpopular, Roger. I was just talking with some constituents earlier today, and you know, their insurance premiums have gone up, which is not surprising when you consider that private insurers are anticipating correctly that they are going to have to provide for a lot of their insurers with a far smaller base of participants because employers are going to be leaving their employees to the public system, to the public exchanges. We know what's going to happen, and it's going to make paying out benefits for the private insurers that much more difficult, and it's going to make private insurance that much more harder for people to afford.
No question about that. All right, Congresswoman Hayworth, Nan Hayworth with us from New York. Now, and Congresswoman, then, what do you think? I mean, if you were able to, you've been in the medical system now for a number of years as a professional,
Sure.
and what would you like to see happen here? Let's assume that the Republicans get a shot at restructuring, replacing this whole thing.
Right. Roger, 4 key points. 1, make health savings accounts the standard for people to pay for their health care. It's consumer-driven. It allows doctors and patients to make the decisions, and we have a model where it has worked very well. Healthy Indiana, which is a program that the state of Indiana put together for Medicaid recipients and state employees, and it's worked great. So that's number 1. Number 2, open up the insurance marketplace so that people can buy insurance across state lines, which they can't do now, and that makes their own insurance very costly in a place like New York that has lots and lots of mandates. That's not fair to people who would find it otherwise very affordable if they had more choice. So that's point 2. Point 3, real liability reform, which we certainly don't have with the 2010 health law, that massive takeover, but it can be done and it needs to be done. It adds tremendously to the cost of care. And point 4 would be for folks who really have trouble finding insurance, fund high-risk pools. We could do that for a fraction of the cost of a massive law that's putting federal bureaucracies in the place of doctors and patients making decisions.
Congresswoman Nan Hayworth with us. She is an MD. She's a doctor, ophthalmologist, and a member now of the House of Representatives. Let me talk to you about some of those points because I'm interested in how you would implement them. Now that government is so deeply enmeshed in health care,
Yes.
what about Medicare and funding of Medicare? How would you handle the seniors part of this?
Well, it's a great question, Roger, and it's a very pressing question because the Medicare Trust Fund, which was built up over the decades in which there were more folks working and contributing than taking out benefits, and of course now the situation's starting to reverse with the baby boomers. So the Medicare Trust Fund, some folks say it's going to run out as soon as 2016, and as a doctor, I find that credible. The 2010 healthcare takeover shifted $500 billion out of Medicare, even though it's been committed to Medicare and it will have to be provided. So we need to make sure that those funds go back into Medicare and not into a massive new bureaucracy. Medicare recipients need to know that their benefits will be intact, that they rely on them. And we need to have a long-term plan to make Medicare secure, and that's what Senator Wyden and Paul Ryan, the House Budget Committee chair, have come up with. That Wyden-Ryan plan. It makes a lot of sense.
Now, talk about that, because I don't think we're as familiar with that as we should be, because, again, the Ryan plan also envisions a $500 billion decrease in Medicare funding over 10 years, just as Obamacare did.
Right. Right, and in the House budget that was passed in March, and unfortunately, as we all know, the Senate's now more than 3 years out, no budget. But in the House budget, we passed a plan, and it is a plan. It needs all to be fleshed out with actual laws, but we passed a plan that says we need to repeal and replace that health law, the massive 2010 healthcare takeover, and in doing that, we will put $500 billion of funding back into Medicare, where it needs to be. And for the long term, for folks who are 55 and under, we need to plan for Medicare providing different alternatives in a better way, more consumer-directed, that will actually save on cost, but still enhance people's choices.
One of the things that I think people object about the most, other than the mandate in Obamacare, is the idea, and we're with Congresswoman Nan Hayworth, who herself is a doctor, an ophthalmologist, an MD, and is now a member of the House of Representatives. One of the things people object to the most about Obamacare is the idea the government can mandate coverage for people, and then, as you say, the costs get spread around. Now, we just got 30 seconds. What can we do about that?
The individual mandate is unconstitutional, plain and simple. It's a thought that was essential to the funding of all those exchanges and all that insurance, but it is something that our Constitution simply doesn't allow. Americans are supposed to have a free choice in these matters. So I think everybody is anticipating that the Supreme Court will overturn it. It cannot.
Well, we shall see, and we're going to run out of time. But Nan Hayworth, keep up the great work. Thanks for being with us today. Appreciate the time.